Hello, everyone, and welcome back to an episode of OSCE Talk. Today, it's going to be very quick, and we're just going to go through sort of high cholesterol and then statin counselling and what to say to patients. I think the main thing to highlight is that for these patients, a lot of them will be asymptomatic. They'll just have a significant number of risk factors for high cholesterol and high blood pressure and heart disease as well. On the outside of the station, it might say something very simply like, this patient has high cholesterol result found by the GP. Please discuss this with the patient. The other thing it could mention is then the QRISK. So I think it's a good idea just to have an idea of what QRISK is. So QRISK is just the risk of a cardiovascular or cerebrovascular event in 10 years. And for GPs and health practitioners to be worried about it, it usually is over 10%. So that's something that you can then discuss with the patient. You've put in their cholesterol, you've put in their age, their weight, their smoking and alcohol intake. And this has shown that they're at high risk of heart attack or stroke in the next 10 years. And then Peter's just going to take you through sort of how to explain what cholesterol is, why it's important to a patient, and then also through statins.
So if you were talking to a patient who came in with high cholesterol, you would be using the normally we can probably manage and also relating that to the QRISK. Because we know if someone comes in with high cholesterol, we mightn't necessarily treat them unless the QRISK is raised. So you would do their QRISK, and if that's raised above 10, then you would counsel them on starting a statin. So we'd use the normally we can probably manage. So you would say, normally in the body, we've got blood vessels and arteries all around the body, and the blood will move nice and easily through them. There's blood vessels in the heart, and every time the heart beats and squeezes, the blood will move through those arteries and supply all the muscles and cells in the body. What happens when the cholesterol is raised? Cholesterol is a sticky substance and sticks to those blood vessel walls, and that can cause a blockage in the blood flow, which could lead to something like a heart attack or a stroke. What causes your cholesterol to be raised? There is a variety of things. So it can come from diet. So we will advise diet modification, but it can also be a genetic component, and we know that high cholesterol often runs in families. As I've mentioned, there's a variety of problems with having a high cholesterol, and that's that this sticky cholesterol can stick to the blood vessel walls, and it can lead to people having heart attacks and having strokes. You then need to look at other things that can cause strokes and heart attacks, which will raise their risk. So people who are smoking, people who have high blood pressure, or people who have diabetes, and in particular uncontrolled diabetes or type 1 diabetics you'd be concerned about. So people with high cholesterol, you really want to improve their heart function and their lifestyle as much as possible. So you want to make sure they're as fit and eating as well as possible. So how we will manage these patients is we will advise diet modification to eat low cholesterol foods. We advise exercise. We advise not to smoke. And then finally, we can think about medications. So there are a number of medications that we can use for high cholesterol, but the main medication that we would use would be a statin.
So we're going to start them off on something like atorvastatin, which will be one of the cheap and easy to use drugs then to help reduce and bring down cholesterol. So I think the easiest thing to do is to say that, this atorvastatin tablet or this statin tablet basically will just help to reduce the bad cholesterol levels and actually boost the good cholesterol levels. And that overall it helps, the heart function, and it helps to reduce the risk of heart attack and stroke. In terms of what it is, it's a tablet. You take it at the same time, and mostly it's taken at night. The length of treatment is important. It is a long-term treatment, and that's to help to prevent MI and stroke into the future. As we were saying about the QRISK score, this is a risk score over 10 years, so this is going to be a longer-term therapeutic treatment. Side effects, again, super simple for this. The main things that people are going to complain about and might ask you about in an OSCE is going to be the GI upset, can be quite difficult in the stomach, and then the muscle aches and muscle cramps. This is something that people find quite difficult to deal with. They might mention muscle aches waking them up at night. If that would be the case, then you could just think about swapping to another statin and trying another one. There are about 4 or 5 that we can routinely try. It's good to be aware of sort of rare complications, things like rhabdomyolysis, extremely rare complication, and that you would just say, look, if the muscle pains or muscle aches were extremely sore, you were finding it difficult to walk, you're actually noticing a change in the colour of the urine, and again, that would be sort of showing that muscle was breaking down at such a significant amount that it could cause difficulties with the kidneys, things like that. They would need to go into hospital. But I think counselling that that's an extremely rare side effect, and that these tablets are normally well tolerated and easy to take. Not very much monitoring required, really. You do a pre-test, you check their level of cholesterol, obviously, and then you also check their liver function tests. Liver function can be slightly impacted by the cholesterol, by the statins, so it's important that this is tested, and then you'll test this again, usually sort of 6 to 12 months afterwards, to make sure that there's no significant rise in the liver enzymes, that it would need to be stopped or swapped. Other big things, if it's a female patient, the contraindications would be in pregnancy. There's not been really any good studies in terms of statins in pregnancy, so they're normally stopped. And then other things things if you start to take antibiotics or other tablets, just that they might need to check if they can still take their statins. You see a lot of patients, especially respiratory patients, will be taking clarithromycin, so they'll be stopped on their statin tablet. Then really all you'll do is you'll summarize, this is a simple tablet for you to take once a day, and it's a long-term tablet. Do you have any questions? And then just give them a leaflet for it. It is one that's very common, and I think it's quite a hot topic at the minute. A lot of GPs are sort of getting a lot of pushback about statins, but they're a cheap and effective way to treat cholesterol, and is something that's likely to be asked at some point in sort of third or fourth or fifth year.
Yeah, it's been in the media a lot. I was actually then just going to ask you that. We know the statins were in the media years ago from newspaper articles posting about them, but more recently with sort of rises in podcasts and stuff, and we've had sort of actual like a prominent cardiologist coming out who students might have listened to who said statins are a bad drug. So what would you say to students who maybe have listened to that and are thinking, is this a good drug to use, or to a patient who's coming in with information that they've heard online?
Yeah, definitely. You can say that these are medications that have been around for a very long time. They're medications that are very cheap. Nobody's really making any money out of them. There isn't a financial incentive to put people on them. It's a medication that works extremely well. We've seen that people's cholesterol can come down very quickly. You can also mention that, as you said earlier, Peter, smoking, alcohol and diet do play a massive part in your cholesterol, but you'll meet young, healthy, fit people with extremely high cholesterols, and that'll likely due to that sort of genetic influence or that familial hypercholesterolemia picture. They're people who will not benefit no matter how well they eat. They need statins to help bring down the cholesterol levels. The other thing that you can say is that, look, you might not want to take this type of statin. There's other types of statins to try. And then the other option would be that there's other type of cholesterol medications to try. There's the fibrate drugs, which just aren't as good, but some people are on them. I think there's ezetimibe as well as a medication some people can be on. So I think it's good to say this is a great medication. It's cheap. It works well, but there are other options to reduce their cholesterol down, and that people sometimes have alternative motives for trying to sell you, diet or other types of medications, and that'll help bring the cholesterol down.
Absolutely. Yeah, and I think something that I found really useful is that what happens with patients is their blood vessels are getting damaged because of maybe being diabetic, smoking, high blood pressure. And if you've got this sticky substance in the blood, that it is going to stick to those damaged vessels and it is going to lead to a problem. So statins are a really useful medication and are shown to improve life and improve life expectancy.
Thank you very much.
All right. Thank you.